Hello, my name is Amanda Staggs. I will be performing a head-to-toe exam. I'm going to be touching you throughout the exam. Is that okay?
Mm-hmm.
Throughout the exam, I'll be performing a skin assessment, looking at color, temperature, moisture, texture, edema, turgor, bruising, scarring, lesions, and nevii of the head, face, neck, anterior chest, posterior chest, and the abdomen. I'm going to start by inspecting the patient's head, looking at shape, position, and symmetry. I'm going to palpate the scalp for any masses, tenderness, lesions, infestations, or indentations. I'm going to be looking at the hair color, distribution, and texture. I'm going to palpate the temporal arteries for tenderness. I'm going to move on to the lymph nodes, the preocular, postocular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I'm going to palpate for TMJ. You can clench your jaw, looking for any crepitus, tenderness, or subluxation. I'm going to be checking for cranial nerves 5 and 7. If you can close your eyes and tell me where you feel a light touch.
Forehead, nose, cheek, chin, cheek.
Okay. And I'm going to be palpating over the masseter muscle. You can clench your jaw and open. And if you can raise your eyebrows, frown, smile, puff your cheeks out, pucker your lips. Cranial nerves 5 and 7 are intact. I'm going to be moving on to the patient's ears, looking at shape, position, and symmetry. I'm going to start by palpating the pinnae and the tragus, looking for any masses or tenderness. I'm going to inspect the auditory ear canal, expecting to find a pearly gray, translucent, tympanic membrane. I'm going to assess the patient's hearing. If you can occlude the opposite ear and repeat after me.
1, 2, 3.
And the other.
3, 4, 5.
And that was the whisper test. And I'm going to be performing the Weber test to see if there's hearing lateralization in both ears. Let me know if you're hearing in one or both.
Both.
Great. Now I'm going to be performing the Rhine test. Please let me know when you no longer hear the ringing.
Now. Now.
Checking that air conduction is greater than bone conduction.
Now.
Great. Cranial nerve number 8 is intact. Moving forward to the patient's eyes. I'm going to be assessing the eyebrows, eyelashes, the papular fissures. I'm going to be looking at the conjunctiva and the sclera for color, discharge, or lesions. I'm going to test the patient's visual acuity and central vision and peripheral vision. If you can occlude one eye and read the lowest line on the chart.
LFTFH.
And the other eye?
LFGPH.
Okay. I'm going to test for peripheral vision. How many numbers do you see?
3.
And the other?
3.
Great. Going to be testing for direct pupillary response and accommodation and convergence. Okay, and if you can follow my pen light. Okay, and if you can look at my shoulder and look at this shoulder. Okay, great. Now I'm going to be checking for cranial nerve 2 is intact. Going to be checking for extraocular movement, if you can follow my finger. Cranial nerves 3, 4, and 6 are intact. Going to be assessing the patient's red reflex, looking at the internal eye structures. Okay, moving forward to the patient's nose, looking at the shape, position, and symmetry. I'm going to check for nasal patency. If you can occlude one nostril and sniff, and the other. And what do you smell?
Candle.
Cranial nerve number 1 is intact, and I'm going to palpate the patient's frontal and maxillary sinuses. Moving forward to the patient's mouth, I'm going to be looking at the patient's lips, teeth, mucosa, the tongue, underneath the tongue, the hard palate, soft palate, posterior pharynx, the uvula, and the tonsils. And if you can stick out your tongue and say ah, the uvula rises midline with phonation. And if you can stick your tongue out, cranial nerves 9, 10, and 12 are intact. Moving forward to the patient's neck, I'm going to palpate for the patient's trachea for position and symmetry. And I'm going to palpate for the thyroid gland if you can swallow. Okay, I'm going to palpate for the carotid arteries. Okay, I'm going to auscultate the carotid arteries for any bruits. Okay, no bruits noted. Moving forward to the anterior and posterior chest. If you can face towards the door. Looking for symmetry or any obvious deformity. It's going to be looking for any signs of respiratory distress, using any accessory muscles, nasal flaring, tripoding, cyanosis, or tachypnea. I'm going to check for chest wall expansion. And I'm going to check for tactile fremitus. If you can repeat the word 99.
99, 99, 99, 99.
Okay, now I'm going to percuss in between the intercostal spaces, moving from side to side, assessing all of the lower bases and lateral bases. Now I'm going to auscultate the posterior chest wall, starting above the scapula, moving side to side, left to right, in between the intercostal spaces, assessing the lower lung fields as well as the lateral lung fields. Going to be a testing for egophony. If you can repeat the word E.
E, 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 E.
And I would further that down to the lower and lateral lung bases. If now testing for bronchophony. If you can repeat the word 99.
99, 99, 99, 99.
And I would continue that assessment to the lower lobes as well as the lateral lobes. And now I'm going to be performing the whisper pectoriloquy. If you can whisper 1, 2, 3. Okay, and I'll continue that to the lower lobes as well as the lateral lung fields. And now I'm going to assess the anterior chest wall, looking for symmetry or any deformities. I'm going to palpate for chest wall expansion. I'm going to palpate for tactile fremitus. If you can repeat the word 99.
99, 99, 99, 99.
Okay, I'm going to auscultate the anterior chest wall in between the intercostal spaces, assessing the lower lobes as well as the lateral lung fields. Moving forward to the cardiac section, I'm going to auscultate the cardiac heart valves, starting with the diaphragm, the aortic, second intercostal space, right sternal border, pulmonic, second intercostal space, left sternal border, herbs, third intercostal space, left sternal border, tricuspid, fourth intercostal space, left sternal border, and the mitral, fifth intercostal space, mid-clavicular line. I would also auscultate here for 1 full minute, noting the rate and rhythm of the apical pulse. I would also palpate here for the point of maximal impulse. Now I'm going to listen to the bell of the heart valves, the aortic, pulmonic, herbs, tricuspid, and the mitral. I'm going to have the patient lie back at a 30 to 45 degree angle, looking for any signs of JVD or jugular pulsation. I'm going to be also inspecting the chest for any heaves or lifts. I'm going to be palpating the heart valves for any lifts or thrills. I'm going to auscultate the heart valves, starting with the diaphragm, aortic, pulmonic, herbs, tricuspid, and mitral. And then with the bell, aortic, pulmonic, herbs, tricuspid, and mitral. I'm also moving forward to the abdominal section. Can I lift your shirt up? I'm looking for symmetry and abdominal contour. I'm going to start by auscultating the abdomen in the right lower quadrant, listening for bowel sounds. Now I'm going to be listening to the abdominal aorta with the bell, and then listening to the renal arteries bilaterally with the bell, the iliac arteries, followed by the femoral arteries. I'm going to percuss the abdomen for any signs of tympany, dullness, or flatness. Going to palpate the abdomen for any masses or tenderness. I'm going to palpate for the liver, and then for the spleen. I'm going to have the patient sit up. I'm going to check for CVA tenderness. Feel anything? Okay, great. Moving forward to the musculoskeletal section, I'm going to be inspecting and palpating the upper extremity joints, including the fingers, wrists, elbows, and shoulders, looking for redness, swelling, deformities, crepitus, tenderness, nodules, and symmetry. I'm going to palpate the radial pulses. I'm going to check for capillary refill. I'm going to check for the range of motion of the fingers, if you can flex, extend, hyperextend, abduction, adduction, finger, thumb opposition, and range of motion of the wrist. If you can flex, extend, hyperextend, radial deviation, ulnar deviation, and rotation. And then range of motion of the elbows, if you can flex, extend, hyperextend, and then range of motion of the shoulders, if you can flex, extend, hyperextend, abduction, adduction, internal rotation, external rotation, and circumduction. Great. And then if you can shrug against my resistance. Great. Cranial nerve number 11 is intact. Moving forward to the strength. If you can please squeeze my fingers with your hands. Strength is 5 out of 5. I'm going to test for the strength of the biceps and the triceps. If you can push against me, not pull against me. Great. And I'm going to be testing the range, strength of the shoulders. You can push against me, pull against me. Same thing on this side. If you can push against me, pull against me. Great. And now I'm going to be performing the cerebellar coordination. If you can do the finger opposition. And then flip your hands back and forth quickly. And then put your finger on your nose and touch me back and forth. Okay. And now I'm going to be testing for sensory of the upper and lower extremities. Let me know where you feel like touch.
Arm, arm, leg, leg, leg.
Okay. Also looking for the overall skin integrity of the warmth, color, texture, edema, and color of the upper and lower extremities. Going to be assessing for sterigenosis and graphesthesia. If you can close your eyes, let me know what you feel in your hand.
A pen.
Okay. And what letter is this?
C.
Great. Okay. Moving forward to the deep tendon reflexes. I'm going to be doing the brachial radialis, biceps, the triceps, brachial radialis, biceps, and triceps, the patellar, and the Achilles, as well as the Babinskis. Okay, and then moving forward to the lower extremities, I'm going to be inspecting the toes, the ankles, the knees, and the hips, looking at the redness, swelling, deformities, crepitus, tenderness, nodules, and symmetry. I'm going to palpate the dorsalis pedis pulse, as well as the tibial pulse, posterior tibial pulse, and the capillary refill. I'm going to check for the range of motion of the toes. If you can flex, extend, hyperextend, abduction, adduction. And then for your ankles, if you can plantar flex, dorsiflex, inversion, eversion, and rotation. And then going to be assessing for the strength of your ankles. If you can dorsiflex against me, plantar flex against me, great. And then going to be assessing for the strength of your knees. If you can push against me, pull against me, push against me, and pull against me, and checking the strength of your hips. If you can push against me, now pull against me. Okay, now we're going to have the, I'm also going to check for the vibratory sensation of the ulnar prominence, as well as the medial medialis. All right, going to have the patient stand up. Going to check for the range of motion of the knees. If you can flex, extend, hyperextend, flex, extend, hyperextend, range of motion of the hips. If you can flex, extend, hyperextend, internal rotation, external rotation, circumduction, abduction, adduction. With the other leg, flex, extend, hyperextend, internal rotation, external rotation, abduction, adduction, and circumduction. And then I'm going to have the patient lean forward, checking for signs of scoliosis, alignment, tenderness. The patient is already in flexion for the lumbar spine, so I'm going to have the patient extend, hyperextend, lateral rotation, and lateral flexion. And then checking the range of motion of the cervical spine. If you can flex, extend, hyperextend, lateral rotation, lateral flexion. And then going to have the patient close their eyes, assessing for any signs of swaying for the Romberg. And if you can walk towards the door, assessing the gait in tandem, and then come back heel to toe. Great. And then if you can hop on one foot and the other, and that concludes the session.